communication really comes down to optionality. Human beings value convenience. It's just what's changed in the last 20, 30 years. And I'll use dating as an example because I think it's the easiest one. Whereas 30 years ago, you didn't really have a choice. If you wanted to meet somebody, unless you did an arranged marriage like we probably did in our communities, right? 30, 40, 50 years ago. You pretty much have to go to a bar. You have to go meet someone. Whereas now when the optionality becomes that or dating apps, people will always opt for the easiest option.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Communication is key in any industry, and healthcare is no different. As healthcare providers, we are not always the best communicators. Effective communication between patients, doctors, and caregivers is essential for better health outcomes and building trusting relationships. Our guest, Brenden Kumarasamy, is the founder of MasterTalk. He coaches ambitious executives and entrepreneurs to become the top 1% communicators in their industry. He also has a popular YouTube channel called MasterTalk. Welcome, Brenden. Thank you so much for being on today.
Of course, Meenal. Thanks for having me.
So, why can we not communicate anymore?
I think that's for a few reasons. Number one, I really believe that communications is a problem for every generation. A lot of people seem to think that and believe that communication is now a problem because of social media and how now younger kids are not looking at each other anymore. They're looking at their phones. And I think there's some truth to that, absolutely. But the other piece that's really important to consider is even back then, people weren't talking to each other that much either. You know, at the end of the day, communication really comes down to optionality. Human beings value convenience. It's just what's changed in the last 20, 30 years. And I'll use dating as an example because I think it's the easiest one. Whereas 30 years ago, you didn't really have a choice. If you wanted to meet somebody, unless you did an arranged marriage like we probably did in our communities, right? 30, 40, 50 years ago. You pretty much have to go to a bar. You have to go meet someone. Whereas now when the optionality becomes that or dating apps, people will always opt for the easiest option. Same thing with phones. Phone calls are a lot tougher, but 40 years ago, you only have the option of doing a phone call, whereas now you can opt for calling people or texting people. So there's definitely a tendency that people are practicing less, but I do feel communication is a prevailing problem across every generation, or else everybody would be in a happy marriage, and that is not the case, unfortunately.
So how is this going to affect us? Like, what do you see as our future, our kids' future?
Yeah, I think it's going to affect us in a lot of ways. Number one, I feel in general, what you don't practice, you don't improve, right? So if you don't get better at something, Meenal, and you know this really well, if you don't get better at that thing, you won't be able to improve on it. So if our children are practicing less on average, it's going to be they're just doing less reps. They're going to be able to communicate less frequently with people, and that's why I have strategies that we can definitely talk about on the show if that's of interest to you, of what I recommend parents and educators do with their kids to get started with practicing communication, public speaking as an art. But really what's going to happen is I think communication is the only differentiator for everything in our life, especially now with AI pretty much going to be replacing a lot of the main things, even in the medical space. This is a healthcare podcast, right? There's a lot of different things in medical that are now, there's now robots doing surgeries now, so things are getting crazy. But really the only two big things that will never be displaced, one of those things is obviously the humanity of the human being, that person who understands the human experience that an AI can't really, because they're not living in that experience. And then the second one is, of course, communication. How we talk, how we communicate, how we talk to people. So especially in this day and age, I really think it's important for us to focus on that for sure.
So let's get into what you said. Like, what can we teach our children? How can we teach them to communicate? They are the future tomorrow healthcare providers, right?
Yeah, absolutely, Meenal. You know, for me, the perspective that I've always taken, which is really the perspective that I've taken for communication in general, that's really where I felt I've brought to this space, is just to be able to make it simple. You know, if you take, I'm sure you've seen those TikToks, right, where you take a microphone, you go outside and you ask people on the street, and that becomes like a clip. Hey, what tips do you have for people to get fit? Even the people who are unhealthy will give you the right advice. Oh, probably go to a gym, right? Probably eat healthier, like less chocolates, more blueberries, and hey, maybe getting a coach, going to a spinning class might be good, so there's more consistency in community. Whereas if you do the same experiment, and you go out there with the same microphone, you start asking people, hey, how do you become a better communicator? No one really knows the answer to that question. They go like, I don't know, dude, like speak more, talk more. And that generality creates obviously inconsistency in results. So really what the trending line is, and I'm going to jump into it right away, is what are some easy things that we can teach people, some exercises that I invented or gotten inspiration from other people. So let's go through them. So the first one that we can do with our kids is called the buyer's presentation. So the buyer's presentation, Meenal, is just about stepping back and saying, our kids ask us for things all the time. Mom, could I have this chocolate bar? Dad, could I have this toy at the toy store? Dad, can I do this? So instead of saying no, you say yes and. So you say, of course you can have this, Gavin or John or Supreet, but you have to make a 5-minute presentation as to why you want it, and you have to present a compelling case. 80% of the time the kid gives up and goes, oh well, I don't want to, I don't do, right. So I'm saving a lot of parents and educators money. But the second thing, which is 20% of the time, they'll actually do the presentation, so it forces them to advocate for themselves. That's just one example of many exercises we share.
So okay, let's flip a little bit to the healthcare providers, because we suck at communication. Like as much as I want to love to blame the patients and the entitled new generation, I also see the flip side where we're not good at it. And most of us are known to have like bad, chairside, bedside manners. Is that just arrogance, or is that communication?
Yeah, I definitely don't think it's arrogance. I definitely think it's just communication. And let me start with from a place of empathy. Obviously, healthcare providers have the hardest situation, probably out of any industry in the context of communication, for a couple of reasons. Number one, and you know this better than I do, I'm just communicating it so people know that I'm coming from their perspective. The first thing is every communication situation is high stakes. Right, like if you're a liver expert, all of your patients are dying from liver troubles or challenges that they're facing with their liver. If you're in dialysis and you're like a kidney specialist, it's not like everyone in the emergency room has great kidneys, right? So every conversation you're having is a terrible one. Every conversation you're having is a bad one. Obviously, there's good news too that comes out of it when you're able to save the patient. But doctors and healthcare professionals, whether they're nurses, whether they're physicians, whether they're MDs, they're always in stressful situations. There's not many situations, unfortunately, in healthcare that are fun to practice communication. And when something is not fun, like the buyer's presentation where you have a kid give a 5-minute presentation, when there's no positive environment to work on something, well, it's doctors and healthcare professionals are not really excited to work on those skills. That's number one. Number two is they're obviously stressed out, right? Night shifts, overnight shifts, they're working all the time. They're always busy. And they always have to keep delivering the same news over and over and over again. And often that news is negative. It's not positive. So it's reinforcing that as well. So the burnout doesn't help either. And then number three, which is more a comment on residency programs in general, where when a doctor goes through residency, yes, they're being taught communication, but they're not really taught communication from the vantage point of, they are to a certain extent, which is like, hey, let's make people's lives better, absolutely. But it's really about which is rightfully so. Residency programs are mostly focused on making sure that the communication chains are accurate and professional. Mm-hmm. So it's a lot more important because there's so much medical terms and difficulties in that communication style for doctors. That's more important for the person in residency to communicate the right thing versus the inspiring thing. Like, you cannot misdiagnose patients. If you say the wrong thing, it's going to screw us up and create liability for the hospital too, or the insurance provider who's funding that operation. So because of the amount of risk, that's what creates the challenge. So I don't blame them.
What's the non-empathetic side? Let's come at it from the non-empathetic side. What can we do to communicate better?
Totally, Vidal. I love that. So the non-empathetic side is about saying, work on communication like a system. So what does that mean? I'll give you a couple of exercises to work on. So there's three in particular. I call it RQV. So the first one is called the random word exercise. So the random word exercise is about saying, take any word that you want, like phone, like potato, like lip balm, like tissue box, something completely random that has nothing to do with your expertise, and communicate a presentation out of thin air on the spot around that word. And this serves two main purposes. Number one is if you can make sense out of nonsense, you can make sense out of anything. If you know how to talk about headphones and potatoes and a bunch of nonsense, when you go back to your specialization, which is the one specialization you're focused on as an MD, it's going to be really easy. Because yes, the terms are difficult. Yes, there's medical lingo and terminology that are challenging to learn, but it's the same conversation every day, all the time, with the same patients. It's not like I mean, maybe if you're like a general nurse, but most of the time, if you're a dialysis specialist, you're just working on dialysis patients for the rest of your career. Like, you're not going to switch from dialysis to neurology. It doesn't make any sense, right? So the conversation's the same. So if you can talk about something random like phones or screens, when you go back to your expertise, you'll be much better. That's one example. Another example is video messages, which is V of RQV, where you just send video messages to your staff, and the video messages are just inspiring. Hey, Meenal, I know you stayed up last night to work on this patient. I just want to say really appreciate all the hard work and everything that you're doing. It makes people's days, especially for these healthcare professionals where burnout is really high, helps us inspire our teams and helps you practice on video too. Now that video is becoming a lot more prevalent across all industries. So now the CEO of, like, I'm one of my clients is CEO of FQHC, and like she has to give a lot of keynotes. She has to present a lot. And she started her career as an emergency nurse. Well, tough luck. When you're at an executive level, now you have to present videos and stuff. And the third one is question drills. So question drills just means, this is probably the most useful for healthcare professionals, Meenal, where you make a list of all of the questions your patients are asking you, and then you role play them, especially with new, fresh doctors. So that way, if a doctor isn't so sure how to answer this question, they can ask a more senior professional, hey, how would you approach this question, and quickly learn the ropes.
Do you find, Brenden, that women communicate differently than men? Like, is there a discrepancy?
In this day and age, I have to be very careful what I say when I'm comparing
Just be
genders.
honest.
But the truth is, absolutely, right? Yeah. Of course, there's a lot of key differences between the two. I'll give a few that I've noticed in my career, but they're obviously generalizations. So the first one that I've noticed, Meenal, is that men are often a lot more direct than women in their communication style. And a lot of this has to do with biology, right? So I'll give you an example. Let's say we think about history, right? So men versus women. And Tony Robbins does a really good job. He's like a big motivational speaker where he asks a crowd of, like, say, 10,000 people. Men, raise your hand if you've ever felt, if you feel unsafe a lot walking at night. Not many guys like raise their hand. They go like, "What do you mean?" And then he asks the same question to women, like, "How many of you feel unsafe?" And then all of their hands just go up all the time, right? So because women are constantly threatened, right, by different. It could be anything or it could be nothing, but it's just that constant threat is always upon them. They're trained biologically to be indirect communicators. Easy example. I always like using dating because it's just easy for people to understand. Yeah. So let's say you're a pretty girl or any girl. You're walking on the street. Guy comes up to you, wants your number, but you're married or something. So you don't want to go no, because if you go no, men are physically stronger than women are, so they might get scared of like being hit. So they say, like, they'll either give them the number or they'll say something like, "Oh, I gotta get somewhere," or something like that. So it's not their fault. Most of my clients are women, by the way, which is very interesting, which is a topic for another conversation. So yes, I get it. Even if I'm a dude, I get it, right? Like, women are trained biologically to be indirect communicators, but it doesn't serve them well professionally. That is the key. So men will always ask for the promotion. Men will always ask what the expectation is from their boss. Men will always ask directly what is the key. Whereas women, unless they're trained to do so, typically will do not do it or do it relatively less than their counterparts. That's what I would say is the main difference. The other two are more generalities. The second one is more around vocal tonality, where women have to be a lot more careful about how they use their vocal tones. I call this double jeopardy. Whereas if men vary their vocal tones like this, they're seen as assertive. Whereas if women do the same thing, they're seen as a bitch, right? They're seen as somebody that doesn't respect them because they just raise their vocal tones a little too high. So the margin of error with women and their vocal tones is a lot smaller than it is with men. So whenever I'm training my women, it's always about doing this to doing this instead of doing this. This is more when I'm coaching men, whereas women, it's more, this is the direction we should be going towards. This is what I feel we should be doing. Whereas men, it's more, this is what we should be doing. So it's the same thing, but you just have to be a little bit less assertive, or else you'll be seen as, like what I just said. That's the second one. And then I would say the third difference, so we talked about indirect communication. We talked about how we're changing our vocal tones.
Yeah.
The third one is probably in the context of careers, thinking about sponsorship versus mentorship. So what I've seen a lot of women in healthcare do is they get mentored a lot, but they don't get sponsored enough. So what that means is, like, let's say they're being coached by a male who's 2-3 levels above them. They'll usually give them like confidence lessons, whereas when they're coaching men counterparts, they're really coaching them how to succeed them. Whereas, so really what I tell women to do is to really advocate for what they want a lot more directly and really seek for those sponsors who can really bet on them in their career, so that way they can move up in the world.
Wow. I feel like my vocal tone might be judged here. So you'll have to tell me at the end how my vocal tone went, Brenden. But, also I feel like there's a cultural difference in communication as well. Do you see that more broadly? Like, can you make those blanket statements about certain cultures are either better, effective communicators in such a way versus others?
I can, absolutely, but with the caveat that they are blanket statements, obviously.
Yes, of course.
But and by the way, your vocal tones are great. Just letting you know.
You have to say that, I guess, today.
Yeah. There you go. So speaking into that, yes, there have been some big differences I've seen culturally over the years. I'll give you an easy one to understand, like Asian culture versus Americanized culture. So Americans, Canadians, it's the same thing. Even people who live in the UK, it's very similar, right? Where we're taught to be very direct communicators. And this applies a lot in relationships where, hey, if there's a problem in a relationship, I want to tell you about it. Mm-hmm. So that way we can fix it. So it's a lot more direct. Whereas in Asian culture, and it really applies across the board, though I would say it's more specific to Japan, Korea, those types of countries, but it does apply to India as well in most Asian cultures, is since we pay a lot of attention to how our communication affects other people, our communication is often a lot more indirect, which is why Asian people tend to be a lot more passive aggressive in their communication, right? So instead of saying like the problem that they're facing in a relationship, they'll just shut themselves off. They'll make snarky comments about the garbage when the garbage isn't really why they're mad at you, right? So there'll be a lot more indirect. So what is the advice, Meenal? The advice is to communicate in the culture that you're a part of. That is the difference. Like, I went to Japan 4 months ago, just as a trip. I love Japanese culture. I know probably 100, 150 words. So I'm somewhat fluent in the language too. So their culture is very different than American culture. You cannot tell people indirectly that you think they're making a mistake. You cannot tell people directly that something's wrong. So you have to either not say anything about it or be super nice about it or just shove it down the point, which is fine because if you're a healthcare professional in Japan, that is your job. Which is to follow the contextual context of the culture in that. Because at the end of the day, what is our job as healthcare professionals? To serve the well-being and safety of the patients within that country. So if that is the context, then that is the context we need to communicate from. Whereas in the context of Americanized culture, yeah, being more direct definitely helps. Like, if you're indirect in that culture, it's seen as rude. It's like, oh, like, why? Like, you're not telling me what's wrong? Whereas in Asian culture, if you're telling people directly, it seemed as offensive too, because just like, well, shouldn't you understand what I'm feeling just without talking to me directly? So those are some of the key differences I've seen. And obviously there's some more differences more ethnically that we haven't really covered. Like Indian people tend to roll V's as W's. So instead of saying like world, they'll say world. Instead of saying water, they'll say water, right? So they'll roll V's. Latinos speak too quickly, so there's definitely nuances. German people are too serious in general, but yeah, you get the idea.
You know what, you talked about the speaking too quickly, because that's something that I do for sure, Brenden. Like everybody says that. So I've actually had to work on that through my years of practicing, is like slow it down, talk slowly to the patients. They're not getting what I'm saying because I'm talking too fast. So how do you know what pace you communicate at?
Yeah, that's a really good question. The way I see it, especially in the context of this podcast, where for 80-90%, unless you tell me most people who are listening to this podcast are actually managing the hospital, not treating patients, but it's probably mostly treating patients in the context of this
Yeah.
show. So I would say 80-90% of your communication, your day to day, having coached a few MDs myself, is really patient communication. That's really what it comes down to,
Yeah.
70 to 80% of the time. The other 10 to 20% is either you're managing staff meetings, right? Which doesn't happen that much because we're always so busy in healthcare. Or if you're an executive and you're managing much bigger teams and you have an executive role, like you're a chief medical
Right.
officer or something. So, what really the advice is to simply work on your pacing in the context of patient communication. That's where you'll get most of your ROI. And I love that you mentioned that proactively. Hey Brenden, I've really started working on my communication because I noticed that my patients weren't understanding me. So really what it comes down to practically for everyone listening is about really picking our top 3 favorite patients that we already have a good rapport with and just saying, hey, like, I'm going to be sharing some things with you over the course of our relationship together. And if you don't understand something, I want you to tell me.
Hmm.
And I'd be more than happy to communicate it better. And whatever you learn from those 3 patients who give you feedback and go like, I don't really understand this, I really want you to take notes on that. That's one thing that we can do. The second thing that we can do, which I think is way more effective in healthcare, is peer-to-peer coaching. So if I'm a dialysis specialist, it's in the culture of healthcare professionals to always give back. Like, obviously,
Hmm.
if you're an
Hmm.
MD, you have to give back to the residency program of your hospital. You're training the next generation of dialysis patients. Not patients, excuse me, practitioners. We're healthcare professionals. So in that context, like really, like you're commenting on the right things, on how to treat the patient better, how to look at the diagnosis better. But what I would add as a point of feedback is also add the angle of communication. Take that extra time with people in residency that you're mentoring right now, because as you're mentoring them, you're
Right.
learning too. Take the time to also listen to some of their patient communication, which you're already doing, but more in the context of, is the patient actually understanding what this person is saying? And I feel that is often missed from healthcare professionals when they're training the future generations of doctors. They're not really coming from the perspective of, does this patient actually understand what's going on? We're mostly focused on, is the new residency doctor diagnosing the patient correctly and saying the right things, which is correct and very important. But once that point is mastered, I would encourage us to focus on the last 80%,
Right.
because at the end of the day, if we diagnose correctly but the patient doesn't understand what the hell we're talking about, then we're not really getting anywhere.
Yeah, and compliance is a big issue in healthcare right now, and half of that is, patient not understanding. So, I know on your YouTube channel and, all over your social media, you talk a lot about hand gestures and body language, I want to say, just the way you move your body and hand gestures. So, I mean, I'm someone who gestures all the time, maybe because I'm Asian. I don't know what it is, or I'm out there, but like, how important are gestures? Like, do people understand communication better with gestures?
Yeah, absolutely, Meenal. So 2 parts of that. One, really quick about audience, speaking to the audience, right, and being more customizable to the audience. You'll notice I'm doing this right now with the podcast, where as soon as you told me there was all healthcare professionals, now I'm telling you stuff that's not on my social media accounts at all. Right, I'm specializing the podcast, so you can tell I've been on other healthcare shows, right? But the first time that I was on a healthcare show, I didn't know those were the main challenges. So what did I do? Which is something we can all learn from, which is I kind of just said spoke in generalities. Then one of those people on the healthcare podcast became a client of mine. But then the second that happened, I started interviewing them ferociously. I started going like, "Is this making sense to you? Like, walk me through your day to day." And I would literally have like lunches with them, dinners with them, so I can understand the world of healthcare. So that way, when I started coaching like big FQHC people, I didn't even know what FQHC stood for. I was like, Federally Qualified Healthcare Center, like what is this stuff? So then I had to learn that business, and then I was like, oh, okay, I got it, and then I was able to do it. So really, the point of why I told you that story, Meenal, is the effort I put in to understand this audience. That is really the lesson that I want to go. How much time are you actually spending with your patients to make sure you actually understand them and that they understand you? That is not a framework. That is just a lifestyle of life. Like, just take the extra time. And if you just do that and ask the right questions, like, if you're in my shoes, how would you communicate my diagnosis differently? Those are questions we don't really ask patients. We kind of just assume that, oh, we're the doctor, so we know the right answer, versus just going, if you're in my shoes, if you were me, how would you explain this back to me? We don't ask that either. Like, explain the diagnosis back to me just to make sure you got it. Right? Those types of questions we can ask more, and then we get more insights. That's one. And then two, on the gestures and body language space. Luckily for healthcare professionals, most of them don't really have to give big speeches or pieces like to big crowds, unless they're doing like all hands staff calls, but that's typically executives doing that. So what I would say is the body language, luckily for this audience, isn't as important. It's a lot more about focusing on what not to do versus what to do.
Okay.
So for example, and you know this, like a lot of this stuff all of you already know, like one of them is obviously when you're delivering bad news to a patient, you don't want to be all flamboyant with your body languages, right? You have your hand on the desk, you somber down your vocal tones, and you tell them the bad news, right? You're not going like, "Hey, I have some news for you." Like, no, you're not shocking the patient's nervous system, right? So that's one piece, is really to tone down the gestures. But also the other side that I feel a lot of doctors and healthcare professionals don't really think about too much is when the news is good, like you can gesture a little bit more too. Like if the news is positive, like use that as an opportunity to really show a little bit more emotion. Well, being professional, but be a little bit more authentic. I think there's room of putting a little bit more humanity back into healthcare. And whenever healthcare professionals are delivering positive news, I think is a great way to practice, because there's no risk in those types of interactions.
Right. I wanted to ask you something on that note, Brenden. When you go into a healthcare office, and I'm sure you've been into one where you see these signs, right, that I feel are detractors, right? The signs will say no cell phone use, no this, no that, be silent. What are your thoughts on that? Like, I know in my offices, we don't have any detractors, because I feel, for me, it kind of makes the patient upset or sad or nervous right coming in. But 90% of the offices I go into, there's these detractors. Do you feel like that already shuts down the communication or that trust relationship between the doctor and the patient?
Yeah, I think that's a great observation. I agree. I think it really comes down to two words, right? Patient experience. And patient experience doesn't really start when you meet the doctor. It starts as soon as you walk into the hospital and you start smelling the air, you sit on the chair, you go see the receptionist. And I really feel all of us in healthcare can do a better job at really taking inventory of what are those different touch points that the patient is having from the moment that they walk in to the moment they frankly walk out, ideally in better shape than we found them in that experience. And definitely the whole no cell phones thing, the piece I'm not a big fan of personally. What I'm a big fan of, which is what typically, I'm speaking really from my experience with clients. Obviously, I'm not a healthcare professional myself. And what I really like about what they tell me is they say, my job is to always walk into every clinic and pretend as if I'm a patient. Because I learn a lot by mystery shopping. That's what a couple of my clients did. Like, they would visit a couple of clinics, and they would walk in and just pretend to be a patient and just walk up to the receptionist and start speaking to them and just write things down. that they're noticing. And it's also, which is a little difficult in healthcare, we both know, since management is not as innovative as we want it to be, right? But obviously in the context or the work environments where the management team is a lot more open, then I think those communication chains are really useful, where you can bring those things that only healthcare practitioners really see on the ground, bring it up to the CMO, bring it up to the operations lead, and just say like, hey, these are a couple of things, and the science is obviously one of them. But I think it's more about just opening that communication channel, because there's 20 things that we could talk about in this podcast that we're probably not even noticing in these clinics that other people are, for sure.
Brenden, are there like different, like, I don't know, like 4 different communication styles, and, you know, people take like personality tests to do these, and then they can better themselves by knowing what communication style they fit into? Like, is there such a thing like a personality quiz?
I'm definitely, there is, right? Like there's
Okay.
16 personalities, there's Myers-Briggs, things like that. My personal opinion though, I'm not a big fan of I like them, like I like the assessment, but I don't like how it boxes us in into like one style
Mhm.
of comms. So the way that I recommend for those of you who want to do this is, it's really about saying the personality quizzes, assessments, it's more about starting a conversation about what is right or wrong about the assessment. I'll give you an example. Let's say me and you are managing a clinic, Meenal, and we have a staff of 50 nurses, physicians, and I don't know, general practitioner doctors, like GPs. And we say, okay, well, we have a 1 day, I don't know how we made the time for this, but there's like a 1 day town hall where we're all just like hanging out together. There's no patients to serve. We kind of just let them all struggle for 1 day, and we all meet together for a day. Okay. So now we do a bunch of personality assessments, and you get your result, I get my result. But the interesting thing is not the result, it is the conversation that ensues from the result. So let's say I go to John and I go, hey John, what did the personality test say about you, and what do you feel is true or not true about that assessment? And then John goes, well, you know, Brenden, this assessment told me that I'm someone who communicates very directly. That's not really true. Like, I feel like I'm a lot more indirect. Oh, tell me more, John. Oh, you know what? I found, like, when I was talking to Lucy last week, said this, and then I did this. That's where the gold is. Then you go like, oh, okay, Lucy, come over here. And then Lucy comes here, and then goes like, okay, how can we improve the communication channel between Lucy and John? And then Lucy goes, oh, you know, I like to be communicated in this way. Ah, okay, cool. So that's how we improve the communication challenge. There's not really like a style where it's like A fits with B, C fits with D. It's more like when you do these personality assessments, you can just have richer conversations
Right.
with people, and those richer conversations and better questions lead to really good insights, which is really the conversations I have with everyone in my family, like with my business partners, where it's just like, yeah, like when I'm talking to my team, I always tell them, there's some meetings, most meetings I won't be in, and I'll send you voice notes. Don't send me voice notes. I don't have time to listen to voice notes, but I'll send you voice notes, and you listen to them. So things like that, right? Just being direct
Right.
about those things.
So, okay, I know we kind of touched on this at the beginning, but I want to ask you it again. Do you, and be honest with me, Brenden, like, do you feel cell phones or like digital stuff um, is the biggest culprit here? I mean, yes, you said we were not great communicators anyways. We just realized it more now. But you know, like I walk in places, doctors are on their cell phone. I'm not going to just blame doctors, everybody, but I mean, in that context, you know, we're sitting on our cell phones between every patient. Our heads are always down. So, do you feel that that is what's going to kind of ruin the next generation of healthcare providers?
I think that's part of the problem, but if I'm being honest with you, I don't think that's the main problem,
Okay.
right?
What do
I
you think
really
is the main
believe
problem?
the main problem is practice. It's just practicing communication. You know, like at the end of the day, like let's say we take one of my exercises, right? The
Yeah.
question drill, where I gave a cool exercise about make a list of questions that patients are asking you, peer coach your fellow healthcare practitioners on how you would answer a question better. So if we're dialysis practitioners, I'd be like, okay, this is a question I got from a dialysis patient. Mina, how would you answer this question? This is how I approached it. How would you approach that? The problem is we don't drill that.
Mm-hmm.
Okay, whether we have the cell phone in our hand or not doesn't fix that problem. Like doctors 40 years ago still were not drilling that enough. Like, is it all of a sudden that we don't have a cell phone that, oh yeah, doctors were practicing this all the time? Of course not, right? That's really the key. The second thing that I feel a lot of people miss is there's a lot of key benefits to technology too that I think a lot of people miss. This conversation is the perfect example of that. Where me and you never would have met in this lifetime. Never. Right? If it wasn't for this Zoom call and the rise of podcasting. And also, there's other avenues that allow us to now practice communication in ways that wouldn't have been possible 30, 40 years ago. So really, and I'll give you an example, like sending video messages to staff is super easy to do now. Whereas, like, let's say in a day-to-day life as a doctor, it's really hard to recognize patients. Not patients, other practitioners who are helping you deal with patients, because you're moving from one patient to another, one patient to. It's just like you don't even have time to breathe and eat, let alone go to a nurse and say, "Hey, I really appreciate the work that you're doing." But when you have that off shift where you're just home, you could quickly take out your cell phone and send 20 video messages.
Right.
So what's my punchline? My punchline is cell phones, technology. It is a tool. Unfortunately, we're all using that tool inappropriately and not correctly. But if we do use the tool correctly, and like we have as two examples here, and we use it more effectively, I think we could be the best communicators of our generation because we have access to more information. Like this type of podcast where I'm like a communication coach. You said you never had a comms professional on the show, right? Right, especially in healthcare, it's so rare, right? It's like now it's like this information exists because of technology. So now it's like you can leverage this information and be the best generation of doctors. So even if a lot of people tend to paint this this image of dismay and disaster around technology, I think there's a lot more hope that I think a lot of people are missing, and frankly, just people aren't leveraging.
Right. I love that. You're a communications coach, so like, have you had that communications breakthrough or like that moment where you discovered like that either you're not a great communicator or that, hey, like this is something I want to do? Like, has there been a breakthrough moment where you felt like, you wanted to change things?
Oh yeah, I mean every day probably, but I mean I'll give you the big highlights. Yeah, so there's been three big challenges in my life that made me realize that I was not a good communicator, or that made me feel defeated around communication. That's why I'm super passionate about teaching it. The first one is I grew up in a city called Montreal in Canada, Meenal. And for those who don't know, Montreal is a city where you need to know how to speak French, and I still live there to this day. But French was a language I didn't know, but I had to learn. I'm fluent in 3 languages today, but I didn't know French at the time. So my parents sent me to French school so I'd learn it. So every day I had to give a presentation and talk to people in a language I didn't even know. So I was stressed out about speaking my whole life because I would stand up there as a second grade student with my sheet of paper with pretty much Egyptian, like random words. It's just all French. I don't understand anything. And I'm giving a presentation. Not very good. Number 2 is I have a physical disability in my left arm. So you'll notice that's crooked. So when I was born, I had an accident that happened at birth where whenever they do a baby delivery, sometimes they use a vacuum to like pull the baby out. And 1 in every 1,000 operations, there's an error that happens in that vacuum. And I was one of those 1,000. I got really lucky though. Typically, when that happens, either the child or the mother dies. We both lived. My mom's upstairs; she's perfectly fine. But my left arm dislocated because of that permanently. So because of that, I was really nervous about speaking. I'm not anymore, but at the time I was, because I'm like, I still have a crooked arm. So whenever I'm speaking, people are always looking at my arm. So you can imagine as a kid how much social anxiety that gave. And then the third big challenge I had, which is more hilarious, is like I literally have a bachelor's degree in accounting. I'm literally the opposite of what you would expect a comms professional to be. Yeah. And I overcame all of that. And that's why I'm a big believer that, heck, if I could do it, especially at the age I did it too. People always complain about the young generation. I'm 28 years old and I coach like the CEO of like big hospitals. Like, what's your excuse? Like, if I can do this, I started coaching people when I was 19. So I've been doing this for a long time. But like, if I can do this, I think people who are in general, who have a lot more experience, who have been through grueling years of medical school and residency, I think you guys can figure out to do a couple of random word exercises here and there.
Yeah, that's so inspiring. Okay, so has anyone ever sent you a text, or have you sent somebody a text where you feel like that is the worst text or email and like totally bombed the communication? Like just because it was sent by text or email, it was communicated completely wrong?
I mean, too many to count. I'm trying to be specific here for the podcast. There's definitely been a lot of times where that's happened. I mean, I'll just give generalities for now, and then I'll
Yeah.
think of specifics. I mean, obviously, you never want to have conversations about your family and relationships over text. That never ends well. Never ends well. Where you're arguing over text, big red flag. Don't do that. Get on a phone call, because a lot of things get misconstrued over text, or a lot of things, like for example, if I communicate something directly, like I want a raise, I need a raise, it almost feels from the other person's perspective, crap, it feels like this person's going to leave the company if they don't get a raise, if it's through text. But if you meet the person, they go like, yeah, I wanted a raise, but, I want to have a conversation about it. Like, what are some So you notice it's a lot more nuanced when you actually meet and talk to the person. I mean, that's happened countless times in my career where, like, I'm arguing over text and, like, they feel like, oh, they felt misheard and misunderstood. But then when I got on a call with them, I was just like, oh, like, this is not the idea. So yeah, I mean, that's happened a lot. And emails too, not anymore, because I'm the CEO of my own company, so it's not really an issue anymore. But like at the time when I was working at IBM and I was doing my day-to-day work, oh my god, the crap emails I would send to clients, it was not good. Totally unprofessional, inappropriate. And I'm sure a lot of people in healthcare can relate, where if you make a mistake, it costs you a ton because of compliance. But yeah,
Right.
we've all been there.
Yeah. Oh my gosh. Yeah. No, I write emails very fast to my team. So sometimes they will call me and they're like, "Were you in a bad mood?" Like, no, I was just writing it really fast. So that's like an example of what you were saying. Like sometimes it comes across as totally rude, but you weren't. You were just in a rush and you just got to the point. So
Yeah, and a lot of that. So this, like, now it's like, what do you do about that, right? A couple of nuances. I mean, the suggestion is probably not going to happen, because I'm pretty sure almost 100% of bad medical news is communicated in person. I'll correct me if I'm wrong. I don't think bad medical news is communicated
No,
over email.
never.
Right? Never, right? That's what I thought too. So there's no room for improvement there. Just keep doing it in person and get better at it. But in terms of the emails that you're referring to,
Yeah.
really what that comes down to has nothing to do with the emails you're sending in that context, I would argue. It's more about you telling the team to say, like, hey, when I'm emailing you this is what I mean. So that way the next time they get the same email at the same tone, they just interpret it differently. Because at the same time, we have to balance both words, Meenal, right? You're a busy doctor too, so I can't just add pleases and thank yous every single time. But if you communicate those things in person and the context in person, then when the emails get sent, it's like, oh, like, I just understand the context that Dr. Meenal is coming from, right? So it's all good.
Of course. This has been so great, Brenden. Tell us where we can find you. Like, there's so many healthcare providers that do not know where to go to improve on communication. Where can we find your, I think you have courses and classes that they can attend. Tell us how.
Absolutely, Meenal. This has been a treat. Thanks for having me. Yeah, the easiest way to keep in touch is Instagram. So just go to my handle, Master Your Talk. Your spelled YOUR, Master Your Talk, and you can just send me a DM and let me know that you listen to this podcast, and I'll send you a voice note.
Perfect. Thank you so much, Brenden. It was a pleasure having you.
Pleasure was mine.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.meenal Agarwal. Until next time, keep those eyes uncovered.